Matt Millen, former NFL player and GM, reportedly needs heart transplant. We and number 39 re in the middle of the 2018 NFL Draft, and many Detroit Lions fans think back to the dark days of the Matt Millen era. But this isn't number 39 a story chiding his draft history or personnel decisions. According to the Morning Call in Pennsylvania, last summer, the former general manager was diagnosed with amyloidosis, a rare disease which, according to the Mayo Clinic, produces an abnormal protein in the bone marrow and is deposited in an organ or tissue. For Millen, 60, that organ is his heart. The symptoms for him were shortness of breath and chest pain. He experienced them for 6 years before his diagnosis. The newspaper reports that Millen, 60, is in need of a heart transplant and undergoes chemotherapy every week as the lone way to treat this incurable disease. The chemo is supposed to slow the production of amyloid, but, according to the Morning Call, after stopping those treatment for a few weeks this winter, Millen had to restart chemotherapy. 2018 NFL Draft Tracker, pick-by-pick analysis of every selection in Round 1. 2018 NFL Draft Tracker, pick-by-pick analysis of every selection in Rounds 2-3 NFL Draft. Every team in number 39's most agonizing pick in last 20 years. The newspaper also shared a moment of levity during Millen and number 39's bone marrow test in Florida last year. The specialist Millen was seen was from Detroit. So, of course, talk of home came up, and, at the time, the struggling Detroit Tigers. At least they're not as bad as the Lions were a few years ago, when they didn't win a game. Millen recalls the doctor saying, not realizing the patient was Lions president and general manager for the first 3 weeks of that winless 2008 season. A nurse filled in the blanks. "I'm glad you weren't aware," Millen joked.